full scope of what the Canadian Parliament does, like things with your role as the Minister of Mental Health and Addiction. What else have you maybe noticed about mental health and addiction care across Canada?
I'm always one to be dead honest. So,
Okay.
um,
I'm ready for it.
yeah, bring it. It's, we know that especially post-COVID and during the pandemic, people, for so many, their mental health really became challenged, and we saw a rise. There was just a recent report about the rise in alcohol use and addictions, like really summing up what happened during the pandemic when people were at home and in lockdowns, and there was so much uncertainty. And, just as we open this conversation talking about what people use different substances to cope when their world is uncertain. And we certainly saw that during the pandemic. And as we've emerged from the pandemic, we know that too many Canadians are losing their lives to the overdose crisis. We saw a spike go up. I am glad to share that we are seeing trends going down around the country in terms of overdose, but that doesn't mean that there isn't. I don't think there's a single community in Canada that has been left untouched by the illicit toxic drug supply and the overdose crisis. And for me, that's where we have to make sure that we're working with provinces and territories so that we are scaling care to need, making sure, like we talked about, being accessible, being equitable, and being timely. And as a federal government, we can't do this, or federal government and communities, like, you can't work in a silo, right? It can't be that everyone's in the tunnel vision of their communities and being like, head down, we've just got to do this. We need all levels of government to be working together, and we need to make the investments in the people who are on the front lines of this, whether it's health professionals, whether it's peer support workers, youth, mental health workers. Frontline communities are workers, and communities have been telling us what they need. And that's how we as a federal government get to respond. So just this past year, one of the programs that I'm really proud of is the Emergency Treatment Fund, where we decided that we would go, yeah, we launched the Emergency Treatment Fund, where we said to communities and municipalities, sit down, get all your stakeholders together, and talk about what you need,
Mhm.
and then submit a proposal to us, because it gives us information of what's happening on communities in crisis, and it allows us to respond with them in real time. So we launched the first call for proposals in November. We're going to be making announcements soon of communities. And that's one piece of the puzzle. We did it for municipalities across the country, but also Indigenous communities.
Yes,
So we
definitely.
wanted to make sure to catch the whole breadth of what's happening across the country in communities, urban and rural, also remote. And the other piece of that was, as you know, with YouthSpeak, and we've had many conversations about this, was the Youth Mental Health Fund.
Mhm.
So really working with community organizations like YouthSpeak to build out and strengthen the youth mental health services that are available to young people. So whether it's our integrated youth service programs, which, depending which province you're in, so shout out to folks in BC, you've got the Foundry, or if you're in Manitoba, it's Huddle. If you're in Alberta, it's Kickstand. We're building these out across the country. There's 93 already in place. And yeah,
93, that's a lot.
93.
That's
We're,
almost 100.
that's almost 100. But the goal is this, is these are places, centers where they're designed by youth for youth to meet your needs when it comes to your mental health and also your health, like, primary care, counseling, employment counseling, harm reduction, um, accessibility and services and supports. Like, really, Carson, is a young person yourself, and you and I have talked about this, where you're teaching us what we need to know. You are, in a lot of ways. You are teaching us. Your generation is not uncomfortable talking about mental health. You're not uncomfortable talking about substance use and addictions in your spaces. We have to catch up a lot
Mhm.
of ways. Like, we've reduced the stigma, but reducing stigma isn't enough. It's the actionable services that come to really, if we're going to blow stigma out of the water and get rid of it, The services need to be front and center. They need to be available. And we need to see, we not only need to see you guys and what you need, we need to really listen and put that listening into action. So that's what I love about the Youth Mental Health Fund, or we have the Youth Substance Use Prevention Program. We launched the Icelandic model this past year, which is also a great program, really meeting youth and community, because we get to work with parents, we get to work with schools, we get to work with young people. And when you bring everyone together in an environment for change based on mental health, it the outcomes are just so much better because for me as a parent, and I really believe the best thing we can do for you guys is build that foundation of resiliency.
Mhm.
Build that foundation where you know who you are, you're comfortable walking through the world, you can name and say what you want and access it. And when we can do that and make sure that there's high quality services available to you, whether it's on substance use services, mental health services, hand in hand, this is when we know that you guys, our young people across Canada, will thrive.
Yeah, wow, there's so much
There's
there.
a lot
I want
there.
to say,
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.